Okay, this is our presentation on speech and language impairment. So speech and language impairment is a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. Speech delays are when you have difficulty forming words or articulating certain sounds. A speech disorder is related specifically to the act of speaking and the physical production of verbal speech. And then language disorders refer to limitations in communicating meaning and underlying language structure. And then more about the speech and language impairment. They start becoming noticeable at a young age, and earlier the child is diagnosed and starts receiving services, the more likely that child could outgrow the disability. And speech pathologists work with these children to work on articulation and sounds to help correct them.
So etiology, some of the causes of speech and language disorders include hearing loss, neurological disorders, brain injury, intellectual disabilities, drug abuse, and physical impairments such as a cleft lip or a palate. So 1 out of 12 children will have a speech or language impairment. Boys ages 3 to 17 are more likely to have a speech or language impairment. More than 50% of children do have speech impairment or language services that they receive. So in order to gain eligibility for this, there needs to be formal testing, and these testing is in the areas of severity of the disorder, articulation/phonology, language, fluency, and voice. After testing, it will allow you to see how much service time they need in this area. It also determines if they need their services provided in a small group setting or on one-on-one.
All right, so some of the challenges that children with these impairments can face, they face a challenge with communicating with peers and teachers, understanding others and the assignments, and participating in class discussions. So some recommended practices that you can do as a teacher are things like an educator should try and create an accepting and understanding environment, and encourage the students and peers to accept them and to be kind, because I know a lot of times students with impairments feel left out or different than the other students. You should model good listening skills and allow the students to fully participate in activities with the other students. It will help encourage discussion and help them to improve their skills. If a student needs an interpreter, you need to allow space for the interpreter in your classroom. It will allow the interpreter to have adequate room for things like sign language. You should provide individual instruction for the students who need it, and it needs to be done in a discreet way to avoid embarrassment or resistance. You should model correct production of sounds while teaching, because some of these students can learn how to read lip movements or produce sounds to your example. And when introducing new vocabulary, you need to allow extra time for students to practice difficult words, like dividing them into syllables so they can practice pronunciation, reading, or writing. And just a few other things, you can allow longer testing time for them, or longer time to complete their assignments. You should always have a discussion with your student to know what they need help with. You can modify activities to make the student feel capable or included. You can modify tests to accommodate to the student. And I have an example. So let's say a student has a speech impairment. You can give them a written test instead of an oral test. And you should always provide the student with the resources that they need.
So ways that students can receive help with the speech and language impairment. There's speech and language therapists, which are professionals that specialize in meeting the students' communication needs, and they have a diverse range of school responsibilities for these students. Related services is just all the support that student may need in order to benefit from special education. And if a child has a disability, this is provided at no cost to the parents. And then supplementary aids and services is all the means that are used to enable students to succeed in a general education setting. And there's also assistive technology, which is technology that the students can use to help communicate what they're trying to say, which I think is really cool, especially if they have trouble speaking and stuff. They can use this technology, and I know it's helped a lot of students and their peers and families. And then the IEP, it just describes the child's unique needs and the services that have been designed to meet those needs.
All right, some national organizations that help with speech and language impairments are American Speech Language Hearing Association, which is a national professional scientific and credentialing association for many speech, language, and hearing professionals, and their mission is to empower and support these professionals in fostering excellence in their practice and advocating for members and those they serve. Another organization is the Center for Speech and Language Disorders. So they're speech-language pathologists who evaluate, diagnose, and treat a wide range of communication needs through therapy and family support. And their mission is to help individuals with communication disorders reach their full potential through family-centered services. And then there's an online service called LD Online, or Learning Disabilities, and it's general information about speech and language disorders. It provides information on different disabilities that individuals may have, helps others better understand their learning disabilities. And the National Association of Special Education Teachers is a national membership association that offers support and help to special education teachers, and their mission is to render all possible support and assistance to these professionals who teach children with special needs. And then the last one is the Stuttering Foundation, which provides information and help for preventing stuttering in young children and provides treatments for teenagers and adults.
And these are just our sources for information from the presentation.